Dr. Jessica Lamar is joining us today to talk about unseen wounds, understanding disenfranchised grief and betrayal trauma, which you can see on the screen. So I had a meeting with Jessica and we were talking and she started talking about this and I was like, oh, you have to join us on the webinar. And she was gracious and is doing that today. So I don't want to take up more time. I'm going to turn it over to you, Jessica, so that you can share about this important topic.
Great. Thank you. So excited to talk about this. It is something I talk about often. I've been presenting about for years at this point. And so it is a deep topic. There's a lot of nuances to it. So with the short amount of time, I just like to prep people that we aren't going to cover everything. So just be prepared for that. And I'm probably going to go pretty quick because this tends to spark conversation with people. And so I definitely want to make sure that we have some time at the end if people feel comfortable or would like to ask questions. So I might like turn my head every now and then to just check on time, just so you are all aware of that. Cool. Okay, so real quick, what we're going to chat about is disenfranchised grief. What is it? Why it matters? We'll do a quick overview of betrayal trauma, but just kind of in the context of linking it to disenfranchised grief. Some of the emotional and psychological impact, healing and support strategies, and then, yeah, a brief Q&A session. Little disclaimer, this is just for educational purposes. Again, if we're answering questions, I won't be able to necessarily give a therapeutic suggestion or intervention, but definitely can answer a question from a more general lens. And of course, there's no conflict of interest. Happy to do this anytime, actually. One of the best parts of my job. A little bit about me, just quick. I am the co-founder and licensed therapist here at the BTRC in Bellevue. We focus on betrayal trauma, compulsive sexual behavior. We run an intensive program for betrayal trauma. And my credentials, Doctor of Psychology, licensed therapist, certified partner trauma therapist, and then in the training for certified couples betrayal recovery therapist. all the letters.
And
Okay.
all useful for helping people. So we appreciate that your dedication to learning more. So
Thank you. Yes, it is. I'm happy that they're doing the trainings on it. Really, it's really helpful. Okay, so let's just dive in. I'm going to start with talking about ambiguous loss. So ambiguous loss, they are losses that they're very unique and they're confusing because they tend to be a type of loss that they lack a lot of clarity. There's not a lot of clear closure or resolution. And so a lot of times what happens with ambiguous loss is we're questioning, are we even in grief? Is this even a loss? So this shows up in two different ways. So the first way is that a person is physically absent, but they're psychologically present with us. So this can include maybe somebody who's missing, or we see this a lot in my type of work, divorce. So where the emotional connection remains, maybe you're thinking about them, maybe you miss them, you're unsure of where they're at or what they're feeling, but they're physically not there. The other the other way that this shows up is somebody who's physically present, but they are psychologically absent. So this is what I see a lot in my work with betrayal trauma when people are still in the relationship. So this occurs when somebody maybe is living with their partner or whoever they are betrayed by, and they're looking at them and they're saying, I know that you're standing right in front of me, but I don't recognize you. I don't know who you are. We also see this show up for people with themselves as they're going through betrayal trauma. I'm looking in the mirror, I see myself, but I don't recognize myself because they're in so much pain and so much hurt and maybe feeling ways they've never felt before, behaving in ways that they haven't done before. We also see this with somebody who is in addiction or even dementia. We see this a lot with Alzheimer's and dementia and those types of things. Okay. So disenfranchised grief. So disenfranchised grief is a loss that is not openly acknowledged or socially validated or publicly mourned. It is the grief that you really feel when society doesn't recognize essentially that you have the right to grieve. Because the loss isn't recognized, the grieving process can be isolating and difficult to navigate. I want to give a little quick story here about disenfranchised grief. So It was developed by Dr. Kenneth Doka back in the mid 80s, I think 85. And he's a professor teaching a grief professor. And he was teaching a master's class, and a student brought up, that she had this experience where her ex-husband had passed and their relationship had ended as a result of infidelity. And her support system were saying things like, "Oh, you won in the end." Or, these
Mm.
statements that were very hurtful and confusing for her. And she realized that she felt a lot of grief. She felt very sad. She shared children with this person. And so she didn't really feel like she had the space or the support or just even the right to grieve the loss of her ex-husband, even though there was hurt and pain. So that's when he started to go down this path and researching, and kind of led to the term of disenfranchised grief. So it fits nicely with how we're talking about it in the context of betrayal trauma. So some common examples of disenfranchised grief are the end of a significant friendship, relationship, struggles with infertility or pregnancy loss, betrayal or job loss, professional or personal. We see this just as just a little caveat. Job loss is pretty traumatic for people, and it's a really big loss, a lot of identity wrapped up in there, and a lot of people feel that they don't have the right to grieve that. So this it's just an added kind of element here. And then on top of the relationships that develop at work, a lot of times those relationships can kind of disappear. And there's just a lot of grief in that. Losing a pet, and then of course the decline of a loved one's health. And we also see that with addiction, or even with ourselves. Okay. So the connection to disenfranchised grief. So because there's no finality or death, there's no clear ending. So that's what makes disenfranchised grief and ambiguous loss like really, really complicated. That's why society doesn't totally recognize it as a legitimate loss. So there's the lack of external validation, which can make the grieving process so incredibly isolating. It makes it really complex. And then as a result, you feel disenfranchised. Okay, so understanding betrayal trauma. So betrayal trauma, the way that we tend to look at it here and how I really look at it is that it is an attachment trauma. It's an attachment wound. So when we're thinking about betrayal and betrayal trauma, we really want to connect with the attachment to the person who has violated you or harmed you in some way. So we build relationships, we develop safe, secure attachments, and then as a result of that, we appropriately depend on these safe attachments. When we are harmed or violated in some way, that's where the betrayal trauma comes in. That's where we start to feel really unsafe with ourselves, with the world, with the person. We're questioning our reality. And that's where we start to see a lot of these trauma symptoms rise up. Some examples of betrayal trauma, this is a short list, are infidelity or emotional affairs in a romantic relationship. Secretly spending money, a lot of times with betrayal trauma, specifically intimate partner betrayal, we do see a lot of financial betrayal, which sometimes is like a lot of work for people to get there to accepting, oh, right, that's a betrayal too. Another form of betrayal is estrangement from a close family member, or being undermined or betrayed by a trusted colleague or employer, and abuse or neglect by a caregiver. Betrayal trauma actually started the term in the early 90s, and the research was around caregivers. It has evolved. A lot of the research has evolved into intimate partner relationships, but it actually started in the early 90s by Dr. Jennifer Freed in doing this early research on the betrayal of our safe, secure attachment. Because as children, we do depend on them. And then when that betrayal happens, it's very, very scary. Betrayal trauma and ambiguous loss. So this is a little bit of what we were just talking about. So when someone who you depend on violates you, or they create a situation where the person is still physically present, but the relationship and the emotional safety is gone, that leaves you in a state, or can leave you in a state, of unresolved grief. So what's important about this is that emotional safety, that loss. A lot of times partners might not even know that's a loss, that could be something that you are grieving. So right away, right in the initial aftermath of betrayal, right, you are in this shock, you are in this disbelief. And so as you start to kind of shift through some of the stages, anger, and you get to grief, you initially can start to say, I'm just grieving the relationship. Well, there's so much more that you're grieving. And this is so much more of that ambiguous loss part, where you're grieving the emotional safety. You're grieving potentially the relationship that you once had, or that you thought that you had, the safety, the connection, all of those things. So you're grieving the disappearance of trust, security, and the person you thought you knew. In the complex part of this, and the unique experience of betrayal trauma and disenfranchised grief, is that they may still be a part of your everyday life. So maybe you are still sleeping in the same bed. Maybe you're eating breakfast together. Maybe you're coordinating plans with your children or your families for the holidays, and yet you're looking at this person and you don't recognize them. So I share that to just highlight the complexity of this type of grief and loss with betrayal trauma. So just, again, another short list of some types of ambiguous losses with betrayal trauma. So the loss of trust, the loss of emotional safety, the loss of identity. This is a really big one with betrayal trauma. A lot of times what we see with partners is there can be maybe such a hyper focus, or a focus on their partner and their behaviors, and it just pulls so much from yourself and your identity. So a lot of times in this work, it's a finding balance with that, and finding a way back to yourself, learning how to live with this. So the loss of the relationship as it once was, the relationship is completely different from here on out. And that can look many different ways depending on the path of both people. The loss of shared dreams and plans. This is also a really big one. We see this a lot with, I thought our retirement was going to look like this. And so just grieving what you had planned together, what you dreamt about, your future. Loss of community or support system. This is another really big one that we see with partners. A lot of partners feel that they can't share with certain people or their community, or maybe they live in a small community, and so they don't want to share with certain people. And so this is where we see a lot of that isolation with partners. And so again, it's balance, right? It's working with people to share with safe people who they really trust, which can feel scary because, like we talked about the first time, there's a loss of trust. So that's where betrayal trauma groups and these other resources that are out there are really, really powerful. The loss of emotional connection and the loss of stability. You know, with grief, I always like to think about grief as and trauma. You're living life one way, and then all of a sudden, your whole world is rocked. And so that what was stable, what was predictable, you know, you woke up living life one day, and then all of a sudden you're living life with all of these losses that you were not prepared for. On top of them being ambiguous, which leads to being potentially disenfranchised. So betrayal trauma and disenfranchised grief. So when the betrayal occurs, the resulting grief is often disenfranchised. So a lot of times people may not recognize the depth of the loss, or you might feel shame or pressure to just move on very quickly. You know, we see this a lot with people, you know, maybe they are sharing with their support system, and a pretty quick response from people can be, oh, just, you know, get out of there, you know, you gotta go, just move on. And for some people that doesn't feel right, or for some people that's not even possible, right? You know, you have a whole life with somebody. And so that statement of just move on, that right there is that the partner being disenfranchised in their grief. So the lack of validation can make the pain even more isolating. So I just, when a partner goes to their support system, the support system can still be safe, right? So the person who you're going to could be a very safe, trusted person, and they don't know what to do. They don't know what to say. They think that they're supporting you in the way that feels right. And then all of a sudden you feel disenfranchised. And now, because you're in the depths of betrayal trauma, now you might categorize, oh no, this person isn't safe. Now what do I do? And we'll talk a little bit about what to do in those situations. I always like to say when I talk about this topic, grief, finances, and sex are the three topics that we don't talk about in our culture. And so with disenfranchised grief and betrayal trauma, we're talking about two of those things. So it makes sense, right? It makes sense that our support system might not know what to say here. And so we'll talk about how to potentially work through some of that. So some statements that might show up, some examples that might show up for somebody who is going through betrayal trauma. And some of these statements might represent some disenfranchised grief. And these are just a few of, I think, a very long list. So the first one is, shouldn't you be over it by now? Again, taking the right away for somebody to feel the pain or the grief. You have to stay strong and keep moving forward. It's a lot of don't let this get you down. You're better than this. Just move on. Really, again, taking away the right, like not a big deal, not a big loss. If you don't cry, that means the loss doesn't affect you. This is one of my personal favorites, because when we're talking about trauma and betrayal trauma, a lot of what can happen in disassociation, of course, is hypoarousal. So you get a lot of a very big freeze response. And so this one, where you have partners who are maybe in freeze, maybe they're not crying, maybe they're not overly emotional. And so it is affecting them deeply. In fact, they're frozen. On top of the reality that everybody grieves differently. Everybody's grief response looks different. There is no right or wrong way to grieve. Another one, it takes half as long as a relationship's time span to get over it. I'm still doing research to learn where this came from. Somebody woke up one day and said, this seems right. And then we put that on a partner who's going through betrayal trauma. And so then there's an expectation of a time span. So now you're working with a partner who's like, oh, it's been a year. It's been 2 years and I still feel this pain. And so now they're shifting into some shame, and then maybe now feeling like, oh, I can't talk to my support system because they think that I should be over it. Another one is you won in the end. We see this quite a bit with intimate partner betrayal of, he or she is a loser, or they, hurt you. So get out now and you won. So invalidating of the pain that the person is feeling. So all of these are just some examples of how a partner may be disenfranchised in their grief and working through their betrayal trauma with their support system. Or sometimes even professional support can disenfranchise a partner going through betrayal trauma if they're not trained in these things. Okay, I'm gonna take a quick drink. Okay, the emotional and psychological impact. So these unseen wounds, they tend to manifest in pretty complex and challenging ways. So some common emotional responses can include isolation and loneliness. So when somebody is feeling disenfranchised or they are disenfranchised in their grief with betrayal trauma, there is this experience that nobody understands their pain, which might be true if they're hearing the statements that we talked about on the previous slide, right? So they just will really start to turn inward if nobody really understands it. And so they will withdraw and isolate. This is where I really like to promote people to engage in a healthy support group. Shame and self-blame, this is big too. So a lot of times we will see partners who will internalize the betrayal, but even more so internalize their feelings of the betrayal. So questioning their judgment or their worth, really feeling like I shouldn't be feeling this way, which again leads to isolation and betrayal, or isolation and withdrawal. Anxiety and hypervigilance. So trust is shattered, which can result in a constant state of high alert, expecting further harm or betrayal. So when the grief is disenfranchised and you're not getting the support or attending to the grief, what can happen is this increase of hypervigilance and then like this inherent need to control, because you have this deep, deep pain. You don't know what it is. You feel unsupported. So then you might over-index on the anxiety and control piece to feel like you have stability and agency in your life. Confusion, disorientation, the world may no longer feel safe or predictable, making it difficult to make sense of your reality. So I really want to bring this back to, if you're going to your support system and they're telling you to just move on or give it 2 years, you were with them for 4, so in 2 years you'll be fine, right? Like it just, nothing feels safe. You're so confused and disoriented to your path. Intense anger and resentment. Of course, a lot of anger towards the person who betrayed, but sometimes there can be, and a lot of times, internalized anger. A lot of times we hear statements of, I should have seen this coming, or I didn't, see the red flags, or I did, and I just ignored them. And so people will then turn that into anger and shame. And of course, we know that that's not true. We know about betrayal blindness and how the brain works to protect us. But in the state of betrayal trauma, this is what shows up for people. So overall, these emotions significantly impact one's overall mental health. They constrain relationships that are safe and secure and make it really difficult to function in daily life. So we actually can disenfranchise ourselves. So I want to put this into perspective of, we go to our support system, we're going through betrayal trauma, and then we get disenfranchised. Then what happens is, when we are alone and we're with our betrayal trauma and our grief, then we can start to invalidate our own feelings. We can start to convince ourselves that the loss really isn't significant. It's not significant enough to give it attention, to mourn, and then that we don't have the right to feel the pain. This shows up sometimes with relationships that maybe are shorter in length, where people say, I shouldn't feel this bad. We weren't even married. And it's just, and so just really taking away your own right to feel. Again, what we know to be true about this is all rooted in shame. There's something wrong with me because I feel this way. And then I'm getting that same feedback from my support system and society and the world that I can just get over this and this is no big deal. A lot of times this shows up, of course, because of social messages, but also personal beliefs. So a lot of times, like, we're not taught how to grieve for the most part, and we're really not taught how to grieve the end of relationships, and definitely ambiguous losses. A lot of times we don't even know that some of these things are losses. And so when we have this confusing feeling going on for us, we don't know what it is. And so we just say, not a big deal, and push it to the side, which of course leads to feelings of guilt and shame. So a lot of times it's really important to work with people on giving voice to the loss, helping them make a list to say, hey, it sounds like you are experiencing a loss of safety. It sounds like you're experiencing a loss of the relationship that you thought you had. And that must be really hard and confusing. And, you have a right to feel that grief. It's a pretty significant loss. And sometimes what we can see with people is just like an instant kind of settle of like, yes, that is what it is. So just giving voice to grief and empowering people to process it and to, I was going to say the word like enfranchise themselves is really helpful and powerful. So some ways that we might invalidate ourselves are minimizing the loss. Other people have it so much worse. This is a big one that we see a lot of comparisons. So really downplaying the deep emotional impact. And so, really sitting in that place with people of how come you needed to do that? How come you needed to downplay your pain? And so that's the number one way that we tend to invalidate ourselves. Feeling unworthy of grief. So if the relationship wasn't within the typical normal standards of what we believe or what we've been taught a relationship should be, or if it was complicated, then people feel that they don't have a right or that they don't deserve to mourn that loss. So then leading people to suppress their feelings around it. And we see this a lot with, relationships that maybe there was a lot of conflict, or we see this, with divorce. We see this a lot with relationships that maybe are not traditional. And so then people carry a ton of shame around the grief of that. And of course, you grieve the loss of any relationship that was meaningful to you. We don't get to choose that for people. We want to work with people to say, hey, like this relationship mattered and it's important to grieve it. Believing that you should be stronger. So imposing expectations on yourself to move on quickly without allowing space for the natural grieving process. This shows up a lot in, workplaces, right? Like we get this messaging of, okay, you have this loss, take 3 days off and come back. And so if that's the message in a workplace with death loss, the message with non-death loss or ambiguous loss is going to be, you got to be strong and just push through. And so if you're not being strong, then you're really going to shame yourself. If you are feeling, pain and you're sad and maybe you're really struggling, people may start to shame themselves for that, which can get in the way of moving through the grief. Guilt over the circumstances. So feeling responsible for the loss, which can lead to punishing yourself by denying your own need to grieve. This is some of what we were talking about a little bit ago, where maybe some partners will say things like, well, I knew when I think back to our first date and they said this, should have known then. And so because I didn't make a different choice, I shouldn't be grieving this. And it's like, hold on. As you reflect, maybe you're seeing things a little bit differently, but regardless, the relationship formed, you developed a meaningful connection, the relationship mattered to you, you are hurt, and you are grieving that. And so again, like sitting with people to encourage them and own their right to their grief. How we invalidate our grief after betrayal. So internalizing blame, some of what we were just talking about. I should have known, or what did I do to cause this? That is a really big one with partners. So the moment we start to turn the focus onto us and take responsibility, we have taken away our right to grieve. We're trying to fix it. We're trying to control it. Minimizing the harm, like we just talked about. To cope with the reality of the betrayal, you might downplay the impact by thinking it wasn't that bad, again, or I should just get over this. This, of course, dismisses the profound sense of loss and violation you've experienced. And feeling unworthy of mourning, again, if the relationship was complicated. Or if you feel, this is a really big one, if you feel that you played parts in the relationship dynamic. So when we're working with betrayal, we always want to work with people and saying, none of this was your fault, right? The way that somebody behaved, the way that somebody hurt you and they betrayed has nothing to do with you or your behavior or anything with you. And then when people maybe start to look at their own trauma history or their own attachment wounds, they might start to say, well, if I was this way instead, then maybe I would have shown up differently. And then maybe they wouldn't have betrayed me. And so because of that, it's partly my fault and I shouldn't grieve it. And of course, that is not true. And so what somebody's bringing to the relationship doesn't impact the pain and hurt that you feel as a result of the betrayal in your right to grieve. I love this picture. It's one that I use in every presentation. So navigating disenfranchised grief and betrayal trauma requires real intentional effort to heal. So from professional support, from your support system, and most importantly, from yourself, to be very intentional in recognizing this is my pain, these are my feelings, and I have a right to this pain. The journey involves both internal validation and external support. So how to validate yourself. So this is a very big question that people ask of how do I validate myself in my grief? So the first thing, of course, is to practice some self-compassion. Start to talk to yourself how you would talk to a friend, how you would talk to your child. What would you say to them? And from a non-disenfranchised grief lens of, oh my gosh, like that is so painful. Anybody would feel that way, just really working on that. I always tell people, write notes down, write a letter to yourself and act like you're writing a letter to your friend. This sometimes can be such a shift for people in their brain, the practice of self-compassion. Name your loss. Write down what you have lost. Clearly identify the loss helps to legitimize the feelings. And so making a pretty lengthy list and focus on those ambiguous losses, the loss of dreams, the loss of plans, the loss of trust, the loss of identity, really kind of make this a pretty intense list, have a lot of depth to it. So people can start to feel like, gosh, like I am in a lot of grief. And create a ritual. Rituals with disenfranchised grief can be really powerful because they're, totally different than loss that is death losses where there are rituals. A lot of times with this grief, there's none of that, which makes it that much more difficult to grieve. And so creating your own, and it could be anything that you want it to be. You could bring in your support system. You can do it on your own. You could take a trip. You could do like literally anything. And so starting to think about that, maybe it's a daily practice, maybe it's an annual thing, right? Like really starting to create a ritual for yourself and honoring the loss and the grief. So communicating with your support system. So if you are feeling disenfranchised in your support system as you're working through betrayal trauma, be direct. If somebody says something that is a disenfranchised statement, tell them that is not helpful. I'm grieving the end of this, and it's been really difficult for me. You could even tell them what you need them to say. Going back to people don't talk about grief. People don't talk about these things. And so it's actually really helpful for the griever to lay it out, to say, this is, if you could say this, or if you could just sit, if you could do this, and then let your support system do those things for you, that's actually really powerful. People don't know what they need. Now, a lot of times people will say, well, I don't know what I need. I don't know how to grieve. I've never, gone through this before. And that's okay. And so let's start to talk about that. What do you think you might need? You might have to try some things on. Something might work, something might not work. But most importantly, if something hurts you, or if your support system is disenfranchising you and you feel like they're taking away that right to grieve, if you notice that you are isolating, tell them. If they are safe and they are a trusted person, let them know. Most of the time, it will be appreciated. Again, explaining what you need. You don't need advice. A lot of times with betrayal trauma, the advice isn't helpful. And so just kind of sitting, I need you to just sit with me. And then, of course, seeking, professional help, therapeutic support, definitely finding somebody who is trained in this type of work is extremely, extremely important. I want to go back to rituals because the role of rituals are really powerful, because when the grief goes unacknowledged by others, creating these personal rituals can be a powerful way to honor your own loss and validate your own emotional experience. And they provide like a really cool, tangible way to process your feelings. All of this stuff is so abstract. And so sometimes having that tangible way to move through the grief or start to feel that grief, it feels like there's movement, right? Like there's a path, and that's really helpful for people. Another thing that I like to recommend to people is to create a dedicated space and time to focus on your grief. So this is especially important if you are noticing that you're self-disenfranchising. So if that's showing up for you, maybe Thursdays at 5 p.m., you're saying, okay, from 5 to 5:15, it does not have to be long. It could be from 5 to 5:01, right? Like it really does not have to be long, that you say, I'm going to sit here and I'm going to say to myself, I have a right to grieve these losses. And then you could be done and then go on, but that is even a ritual. It's deliberate, and it helps provide a sense of control that we see a lot with betrayal trauma. People feel as though they've lost complete control of their lives. And so being this intentional around the loss of control in this grief is really powerful. So some more examples of rituals are writing a letter, lighting a candle, creating a memory box, or a symbolic action. This is, again, just a short list, a pretty general list, nothing super specific, but these are just some kind of general things that you could do for rituals. It's so quickly. So this is one of my favorite quotes. Grieving allows us to heal, to remember the love rather than the pain. It is a sorting process. One by one, you let go of the things that are gone and you mourn for them. One by one, you take hold of the things that have become a part of who you are and you build again. And then this picture, I used to have this up in my office. I should print it and put it back up in my office. We think how we want grief to work, right? We want grief to be so linear. We have been taught about the stages of grief and all of these things that should be this clear path towards acceptance. And it is not that. Grief is messy, and it is confusing, and it is complicated. And grief isn't one emotion. Grief is many emotions rolled up into one. And grief is also complicated because it can be so many different losses. It can be so ambiguous, so confusing. So it is messy. So a couple more interventions. Disenfranchised grief is grief that should be treated as any other grief situation. So if somebody comes to you and says, I am grieving the loss of my dreams and my future, or the relationship that I had, or the trust in my partner, my safety, treat it as any other grief situation. Ask the person, what do they need? How can I help? Be sensitive and aware to the range of losses that are experienced. We have sometimes a pretty narrow view around grief and loss and what's acceptable or not acceptable, or how people grieve or how people don't grieve, will open up your mind to the wide range of those things. Loss is always individually perceived and evaluated. We do not have the right to tell people what is or isn't a loss. People, they define that on their own, and then we support them in that. Assist the griever in understanding what factors may be disenfranchised. And so that could be all of the ambiguous losses that we were talking about. So a lot of times people will say, I'm grieving my relationship. Okay, yes. And what else? Because we get so much from relationships, so much. And so when that relationship ends or it changes, there's so many losses that come with that. And if you don't know what else to do, you're really just like, I don't know how to support this person. Validate, validate, validate. It is so meaningful to have somebody validate, especially when it's in grief and they are in the experience of being disenfranchised, or if they feel that they don't have a right to grieve, they're disenfranchising themselves. Therapeutic rituals. So in a therapeutic setting, what could be helpful is something that we talked about with for people to do on their own is setting aside time. Even in a therapy session, you could say, hey, like, let's maybe set aside 5 minutes to talk about your grief, or add to your, your list of losses, right? So you can start to model that in a therapeutic setting. Give language to it, give voice to it. And a lot of that stuff is really beautiful because you are giving them and showing them that they have a right to grieve, and that it's really important. I always tell people, therapists, non-therapists, whoever, take a personal inventory of your own grief. We tend to be uncomfortable with things with other people that we are uncomfortable with ourselves. We can only take people as far as we're willing to go ourselves. And so if this is something that is uncomfortable for you, make a list, take your own inventory, figure out what about it is so uncomfortable. So you don't disenfranchise yourself, and you don't disenfranchise people who you love and you care about deeply. And that is it. Let's chat.
And we've got questions. I've got so many
Oh
questions,
my
but we
gosh.
have questions. No, like seriously,
Okay.
I've got had things highlighted. So
Okay.
I'm going to just start with the ones that are in the chat. You can, or in the Q&A, you can follow along by clicking on the Q&A at the bottom of the screen.
Can I stop
And
sharing, or
yes, you can stop sharing so we can see you.
should I leave this on for my contact, or no? Just
Everybody take a quick pick. Otherwise, email me and I will send you her information too. So,
great. Okay. I will.
okay.
Okay.
Excellent. Okay. So in the Q&A,
Yeah.
so I think it's important to not conflate speed with strength, not saying you don't need to be strong and move through it quickly. And it's okay to not be strong. Feeling is strong either way.
Yes. Yes, it is. Yeah. Validating that. Absolutely. The fact that you are feeling the pain, like that's step one. Absolutely. And stay in that. Stay in the feeling.
And I love this is self-validation, or if it's for someone who is in grief, if you're sharing that, that would be really validating, I think.
Mm-hmm.
Okay, so the
It's
next one is, what
experience.
resources, books, websites, etc., do you recommend for better understanding and processing grief?
So there's a few. Obviously, Dr. Doka's stuff is really powerful. The Grief Recovery Handbook is a book that I recommend a lot to people. It's a little purple book, and it talks about death loss and non-death loss. And that is a book that I tend to rely on often, especially because it's not overwhelming, especially when we're talking about betrayal and betrayal trauma. Like, it's kind of oh yeah, you got it. Perfect. Okay. It's easy to digest, and it's something that you can talk about in session, outside of session. It's like my go-to book for this.
And there are grief groups, and I don't know how much grief groups talk about more of these disenfranchised things,
Mhm.
but it may also be you just share, I'm in grief, and and connection in
Mhm.
that way. Okay, this is a comment, not question.
Okay.
Disenfranchised grief and invalidating our grief is amplified when the partner who betrayed us does the very things we are doing to ourselves, minimizing what they did, blame shifting, places themselves in the victim role, pushing us to get over it faster or get over our anger. Thank you
Mhm.
for validating the fact that I get to be as angry and sad as I need to be for as long as I need to be. No one
Mhm.
tells us this, and I think it can really stunt our ability to work through this terrible situation that I didn't choose. I
Mhm.
wouldn't wish this on my worst enemy.
No, no. Yes, you get to feel what you need to feel, and hopefully feel safe with somebody or someplace to process that. Because yes, it is life changing, it is life altering, and it is confusing. And grief is wrapped up in there, and you have a right to feel that. Absolutely. I was going to say too, real quick about the groups. A lot of times,
Sure.
therapeutic groups, betrayal trauma groups will have certain topics, right? And typically they'll include grief in that. So that could even be a place.
Yes, and we talk about grief a lot, the loss of, the relationship you thought you had, the loss of the partner you
Mhm.
thought you had. When you're talking about the loss of the dreams, like with the retirement, there are people that were planning to have a family. And so the loss of, like, do
Yes.
we even have children? I mean, like, there's so much. And, I
Yeah.
was thinking when you were, talking, it's like, you wake up one morning and everything's different, but you keep getting hit with those waves of, and there's more,
Yes.
so you have more
Mm.
realizations of another piece of the lost puzzle, so to speak.
Mhm. Yes.
Betrayed wife here attempting reconciliation, but the extended families are not allowing any room for my or our grief.
Mm.
Very much don't talk about it and move on messaging. How would you recommend communicating with family members who know about the infidelity, though not the whole
Mhm.
story of addiction and narcissistic abuse, to help them find a path to giving more space to my and our grief?
Okay. Okay. Oh, so sorry to hear this. So my recommendation based on what you're sharing, and this is of course just a general response, is you not everybody is safe, right? So if you are not getting that helpful feedback, if you are not getting validated, if people are contributing in some way, shape, or form to the pain and you're feeling that you need to defend or explain and all of those things, it simply may not be safe. And so this is where communication boundaries, I think, are really, really important to say, I'm going to share this with you, and you actually don't get to say anything back. I'm sharing this with you because you are a part of this system. And for whatever reason, I don't know the dynamics, it's important for you to know just this piece of information, but it's not important for me to know how you feel about that. And that's a pretty strong, firm boundary, but important. Just because you're sharing the information does not mean that you are inviting certain responses. So set that up with a pretty clear communication boundary.
And I'm thinking with in-laws and things like that, that's a challenging one to
Yes.
hold. So,
Yes, it is. It is. Yes, it is so challenging. And you need, the support, of course, from the partner would be helpful in supporting you in that boundary. If they're not, your boundary stays. Your boundary isn't less important if you're not getting support in it. That is tough. And just be clear.
and
Go ahead. Hmm.
no, I was gonna say, and it also, like, your level of engagement with them, like they may be, your family and all that, but they may be like, we need to have some distance. So they may be like, okay, we're showing up at Thanksgiving, we're having dinner, and then we're leaving. I mean, it may be you limit the time, you limit the involvement,
Hmm.
because right now that isn't helpful, and even from what
Hmm.
you're sharing,
Hmm.
detrimental to your recovery. And if they say anything, you say, well, we would like to, but we would need to set different parameters for
Hmm.
how we engage. So,
Hmm.
there's so much challenge with all this.
So much. And remembering you're in trauma, you're in active trauma. And so, recognizing that for yourself, that if you're in active trauma, certain situations are not safe. You wouldn't walk into a burning house, so take care of yourself. Yeah.
Betrayed partner here, 15 months post D-Day. I'm grieving the loss of the relationship I thought we had, but I've also been in a holding pattern, waiting to see if he'll choose recovery, waiting to see if I stay with him or not. I'm hoping he gets it together while anticipating the possibility of the relationship ending. How to navigate anticipatory grief when you don't know what's going to actually happen. I'm in limbo.
Hmm. Sounds like you are currently in the grief. Like you're currently in the grief process is of not knowing what's going to happen. Yeah, this is where I would recommend, of course, recognizing like you're doing here, validating I am in my grief. And then, going to your support system of saying, I'm just really confused. I don't know what to do. And then start to engage in. So a lot of times with grief, we feel that we can't feel joy, or we don't know what to do, and we struggle with connecting with other relationships. The most important thing for us to do in grief, specifically anticipatory grief and not knowing what's coming, is to create deeper connections with our safe support system. Start to create some things in your future that you know are coming. So even though you are in limbo with this, you don't know what's happening here. Well, let's start to create some other things that you do know what's going to happen for yourself and other safe relationships.
Okay. Um, how can I start dating after 4 years alone, after a deep, messy divorce with lots of lies and relocation and betrayal? I can't move on and I hate men and
Yeah.
everyone. Oh,
Mhm.
wow. That's so painful.
It is so painful. You know, it sounds like, to start dating after so much betrayal and trauma is to continue to process the trauma, is to really recognize that forming a new relationship or forming an attachment is going to be very, very scary for you. So move very, very slow. I always tell people if they're going to start dating again after betrayal, really strengthen your friendships or other safe people in your life. Like strengthen those and make sure those are so, so, so safe and secure. So you know that you still trust people, you still have people that are there for you. Then if you want to start dating again, you go so slow and then you can check back in with your support system. But dip your toe in and go very slow if you feel ready. This is a tough one because I think sometimes people feel pressure or this is a tough one. But go very, very slow. And if it's too much, step out. You don't have to go fast.
And this one, I really would encourage you to get professional help because when it's that global and everyone,
Yeah.
because there are safe people. I
Hmm.
promise I have very good friends that are very, very safe and so when it's that globalization of everyone, then having professional help, to help you navigate that would probably be really important.
Yes, I agree.
What if the person who feels unsafe to me is a therapist? What about multiple ones? Is this a me issue or are there many unsafe for me during this time?
Oh, uh, I think interesting. I would voice it to your therapist. I'm not sure if they're your therapist, if the betrayer is a therapist. Um, but if they're your therapist, I would voice that to the therapist. And then maybe start to seek out some different therapeutic support. Yeah, I don't like
Uh,
that.
I don't either. And
Mhm.
unfortunately, like I have lists of people who I refer to and people that I don't. There's
Yeah,
reasons.
yes,
To me, I'm concerned that like a generalist therapist is not going to understand the
yes.
magnitude of betrayal, trauma, et cetera. So getting the right people, the right
Mhm,
professionals. So for me, this feels like you haven't, I always say if you've got cancer, you go to the cancer specialist. This is when you need the right people to help, not just a generalist therapist. And even within the CSAT and APSAT community, there are people I don't refer to. I'm sorry, but I'm picky. So
mhm,
so I wouldn't give up, but I would really look for the right person who's trained to help support you in all of this. And voice. I have felt multiple
Yeah.
betrayals by previous therapists, and my concern
Mm,
is, you know,
yes.
advocate for you.
Yes.
Okay. So to piggyback off the last question, so it was a few, same question. This is what I'm dealing with our adult children. What
Mm.
is appropriate to say to them? They see it as a merry-go-round.
Yeah, so this is tough because with adult children, Ken Adams has amazing work on
Yes.
adult children of sex addicts, and I love his stuff. And one of the things that I always tell people is you always want to seek consent from your kids, especially the adult children of like, hey, there's some stuff that has happened. Do you want to hear about it or do you not? They may not want to hear about it. And then that just kind of, then you adjust the dynamics of the relationship. But I would recommend going to some of Ken Adams' stuff because he's, I think, the only one like doing some really great research on this, and it is so helpful. Um,
We actually had Leilani Sinclair. She's co-authoring the workbook with Dr.
Ah.
Ken, and she did a webinar on the topic of adult children. But going back to also, I mean, really go back and watch that webinar. She did two parts around February. It's on our previously recorded, and I just want you to like get support, get professional help. Don't do disclosures with even
mm-mm,
adult children around this.
mm-mm.
And we're out of time. Thank you so much. I'm going to hit the recording's going to be posted later today. I'm going to ask you back. So come back. Thanks, everyone. Bye.
Thank you. Bye.